I was diagnosed in November of 2009. I had stage 3 colorectal cancer. I was 23. And the whole being diagnosed and going through chemo and radiation and treatment process took from November until the following March of 2010 when I had surgery to remove the tumor. And at that point I'd had 7 weeks of daily chemo and radiation while I was still going to classes and finishing school. Before radiation begins, the doctors will take you in and you get a mold made. So I went in and I had a mold made of my legs to keep me still during the process so I'm not jumping around, and so they can line me up within that mold. And then they also will either use a Sharpie, or they'll sometimes tattoo people with little dots where the laser beams need to go on your body. So that's better for accuracy. You can only have so much radiation in your lifetime, which is why people always wear the protective wear when you're doing x-rays, and nurses and doctors can't be in the room when you're doing radiation. So there's only so much of that you can take. But so far I haven't reached that limit, luckily. People always ask me how radiation makes you feel and what kind of side effects that has in comparison to having chemo. But radiation really, for me, just made me really tired. There's no pain involved with radiation. You can't feel the process happening. What happens is you go into this vault of a room, and for me, I was laid down on the table, like face down on this table, and you just lay there as still as possible because there are radiation beams getting shot at your body. So you don't feel it, you just hear the machines whirling around you. So you feel worse over time. You don't feel the effects right away necessarily, especially with radiation. So week 1 versus week 7 for me the first time, I barely felt anything from radiation at first, and then it was the other side effects that you really start to feel by week 7, and then that's when you take a break and then you wait for the next MRI. So the cyberknife surgery, the radiation is much more concentrated and it's to a much more specific area. So if, like in my case, if you have a very, very small tumor, instead of radiation just getting at one area, and then also getting that surrounding area, it's more concentrated and it would just hit the tumor. Like in my first surgery, my original tumor in 2009, when I was diagnosed, was the size of a softball. So I had to have surgery for the size of a softball, even though by the time I'd had radiation, it had shrunk down to the size of a lemon. So they were just taking out the lemon-sized tumor, but they had to go all the way around it to make sure that they got those cancer cells. But with the cyberknife, it would be much more concentrated on that lemon, so you wouldn't have to go around in such a big area.
Okay, I'm a nurse practitioner, and I don't know if you know the difference, but a nurse practitioner is a nurse who has gone back and gotten usually a master's degree and does physical exam, diagnosis, taking care of patients, can prescribe, basically like a family doctor. For me, the hardest part about that is that it's in an area where we're going to hit other organ structures. So for me, the hardest part is to try to make sure that we avoid as much of the bladder, as much of the bowel as we can that's not involved directly, the whole female organ system. Those are the things that I think are really important, because if you're curing somebody of a cancer or even putting them in remission, they have a life, and you want them to have a good quality of life, not just, a cure for that cancer. It does get down to a smaller field, I will tell you that. A cyberknife will get down to, they can get down to about 1 centimeter, whereas ours, our stereotactic, like the best we can really do is about 2 centimeters.
Technology like this and the development is really important because obviously patients are already going through enough just with the diagnosis and the side effects of everything and just the backlash of the whole thing. So just having the precision and the accuracy to actually conquer the disease is really important to the field.
I'm a survivor, I'm gonna make it, I will survive, keep on surviving.